let us continue the therapeutics of hypertension. Case 5. A 72-year-old man present to the office for routine follow. He is under treatment for the hypertension and congestive heart failure with enalapril and diuretics. Enalapril is angiotensin converting enzyme inhibitors. His blood pressure is under acceptable control and he has no symptoms of heart failure at present. He does complain that he has been coughing frequently, dry cough in the past few months. History and examination reveal no other cause of the chronic cough. So you decide to discontinue his enalapril and start him on losartan, which is an angiotensin receptor blocker. What is the mechanism of action of enalapril? It is angiotensin converting enzyme inhibitors. What is the likely cause of the cough? Bradykinin, and which increases the prostaglandins and responsible for the cough. When the patient on the angiotensin converting enzyme inhibitors therapy, when the patient on angiotensin converting enzymes therapy, probably the cough is an adverse effect due to formation of the prostaglandins and the bradykinin. Name a drug that can be used treatment for this dry cough in this patient and justify your answer. Now here we cannot prescribe the antitussives for the treatment of cough because the cough is due to bradykinin and the prostaglandins. So antitussive will not be helpful in these patients. We need to treat by using non-steroidal anti-inflammatory drugs. And amongst the non-steroidal anti-inflammatory drugs, the Sulindac is most widely used because renal sparing effect. It does not affect the renal prostaglandins and renal functions. So here you can use Sulindac from the category of non-steroidal anti-inflammatory drugs because these drugs inhibits the prostaglandins and bradykinin, and cough will be relieved due to inhibition of the prostaglandins and the bradykinin. And plus, in addition, it has a renal sparing effect. It does not affect the prostaglandins in the kidney and does not affect the GFR. Is losartan is a good choice for replacement of enalapril? Justify? Yes, obviously, if the patient having the contraindications, hypersensitivity, or adverse effect with the angiotensin converting enzyme inhibitors, you can use losartan, which is angiotensin receptor blocker, having the same mechanism of action. Both drug inhibit the angiotensin 2 receptor. So obviously, you can prescribe same pharmacological effect, and patient will not experience the cough. And what is the mechanism of action of losartan? It is angiotensin receptor blocker. Case 6. A 50-year-old man present to follow for his hypertension. He is maintaining a low sodium diet, exercising regularly, and taking metoprolol at maximum dose. Metoprolol, which is a beta blocker. He's on other medications. He is on no other medications, only metoprolol. His blood pressure remain elevated 150 by 100. His examination is otherwise unremarkable. You decide to add a thiazide diuretic to his regimen. He is on the beta blocker, and you wish to add thiazide diuretic. What is the mechanism of action of metoprolol? We can say it is an the cardioselective beta 1 receptor blocker, and it thereby decrease the cardiac output and decrease the blood pressure. What is the mechanism of action of thiazide diuretics? Thiazide diuretics inhibit the sodium and chloride reabsorption in cortical diluting segment of the ascending loop of Henle, causing increased excretion of sodium, chloride, and water. And due to this, volume will be decreased, blood volume will be decreased, and decrease in the blood pressure. What electrolyte abnormalities commonly occur with thiazide diuretics? And as there is the excretion of the sodium and the chloride, so these electrolytes will be deficient in the patient using thiazide diuretics. What are the other side effects of metoprolol and thiazide diuretics? This metoprolol having the effect of adverse effect, as we discussed in the previous session: heart failure, bradycardia, and heart block. And diuretics generally having the fluid and electrolyte imbalance are the most common adverse effect. Next case 7. A 55-year-old man. Patient is presented to you by hypertension and chronic renal insufficiency. In the patient, GFR is less than 30 ml per minute by 1.73 meter square. Can you give diuretic in this case? What and why? Now the patient age is 55-year-old, hypertension, and only chronic renal insufficiency. In the patient of the chronic renal insufficiency, we cannot give diuretics in the patient of the chronic renal insufficiency. As per the chronic kidney disease recommendations, just we seen here, patient with the chronic kidney disease, here only recommended drugs are angiotensin converting enzyme inhibitors or angiotensin receptor blockers. So you cannot prescribe the diuretic because the patient having the GFR is not able to work and GFR rate is less than 30 ml per minute. Can you give angiotensin converting enzyme inhibitors in this case? When and why? Yes, now angiotensin converting enzyme inhibitors or angiotensin receptor blocker is the first line therapy because they decrease the progression of chronic kidney disease in diabetic and non-diabetic patient. Also, this drug decrease the microalbumin urea. What is the precautions during the use of angiotensin converting enzyme inhibitors? These are the precautions when the patient use angiotensin converting enzyme inhibitors. Initial dose should be small and at bedtime to avoid orthostatic hypotension. Measurement of blood potassium, blood urea, serum creatinine before and 1 week after the use of angiotensin converting enzyme inhibitors. Then every 3 months, and there may be the increase of serum creatinine by up to 30% is accepted when angiotensin converting enzyme inhibitors are used in treatment of chronic kidney disease. Use diuretic with it should be cautiously, as it leads to the decrease in the blood pressure, which leads to first syncope. But in this case, we are not using diuretic. What are the other antihypertensive drugs used in the renal insufficiency? Calcium channel blocker is the second drug, because the calcium channel blocker decreases the progression of chronic kidney disease better than thiazide diuretics. So if you wish to add the second drug to the angiotensin converting enzyme regimen, calcium channel blocker will be the best one. Mention the drug that should be avoided in the treatment of hypertension in patient with renal insufficiency. Beta blocker and the diuretic should be avoided because they decreases the blood flow to the kidney. And if you are using the another drugs including the beta blockers and the diuretics, they may leads to the renal insufficiency. They are not, kidney is not able to metabolize or filter the GFR properly. So the beta blockers and the diuretics should be avoided. A 35-year-old pregnant lady with moderate degree of hypertension. What are the antihypertensive drugs in this case? Pregnant lady, alpha methyl dopa, or we can say labetalol, is the mainstay in the management of the hypertension. As we discussed before, in the pregnancy, to manage the hypertension, alpha methyl dopa or labetalol is used, and we can say the drug of choice. Mention the dose and route of administration. Yes, obviously by the oral route, tablet 250 to 500 milligram tablet 3 times a day. Alpha methyl dopa should be used. Name 2 antihypertensive drugs that should be avoided in pregnancy and justify. As we discussed in the lecture session, all A's are avoided, including angiotensin converting enzyme inhibitors, angiotensin receptor blockers, direct renin inhibitor, aliskiren. They should be avoided because this drug has teratogenic effect, and that's why avoided during the pregnancy. Thank you very much.